How can different mental health providers support homeschooling families on their home education journey? Stay tuned to learn more.
I've seen a lot of change, been through a lot of pain. Some things are not the same as they were a year ago.
Hi, I'm Kimberly, licensed professional counselor of over 20 years and a homeschooling mom for 5 of those years. I am also the founder and CEO of the Homeschool Counseling Network. Finding the right mental health provider to help support your family's mental health or counseling needs or even testing needs can sometimes feel like wandering alone in the wilderness. It can feel like a big old pot of jumbled up alphabet soup. All these different acronyms and initials and letters at the ends of names can be a little bit confusing. Do I need a master's level provider? Do I need a doctoral level provider? Do I need someone in medicine? Do I need someone in education? What does it all mean? It can be very confusing. Today, in this video, we hope to help tease apart some of the different degrees that are out there and help give you a little bit of an introductory bit of information as to what the different degrees mean, what they stand for, and the different services each of these practitioners can provide. So for starters, the Homeschool Counseling Network at homeschoolcounselingnetwork.com is your go-to resource for a giant resource list, multiple resource lists actually, of a variety of different professionals to help support you on your home education journey. And if you like the contents that you see in this video, please consider clicking the like and subscribe button so we can continue to bring more free content for you. But today, back to alphabet soup. Okay, so back to the alphabet soup of all of the different providers that are out here that can support you and your family on your homeschooling journey. When it comes to alphabet soup, there's quite a lot of us out there. I'll start with the master's level clinicians. That's what I am. That means I completed my 4 years of college education, received my bachelor's degree. In my case, it was psychology. And then I went on to 2 years of graduate school. And I earned my master's degree. Mine is actually in applied psychology. This is where it gets a little different. But you can earn a master's degree in several different disciplines or related disciplines, depending on the state that you live in, to earn your license as a licensed professional counselor, as I did. At the time, I earned my license in Georgia. That is where I received my first license. So pretty much for any master's level clinician, they're going to have been through 6 years of college, and then especially if they are working in mental health, they're going to have, depending on the state where they live, because state requirements do vary with what requirements the clinicians need to meet in order to ensure that they've had proper training and proper education. That includes coursework that they take while they're in college, and it includes supervised hours of work postgraduate. That means once you have finished all of your graduate level coursework, you're also going to do a little bit of clinical work or clinical hours, as it was called in my program, when you are in graduate school. But then postgraduate school, you are going to work under the supervision of someone who is fully licensed and usually who has a supervisor credential. At least that is the case here in Texas, where I live now. For anywhere from, it's in terms of number of clinical hours or in terms of years, believe it or not. So then you are able to, once you pass all of that, there is also a licensure exam that you have to take. After you pass all of that and you have all of your supervision hours and you've dotted all your I's and crossed all your T's and you've met with your supervisors, so they can pretty much say, hey, I've reviewed their work. That can be anywhere from reviewing clinical videos where you've taped with your client, or audio. In my day, it was literally a cassette. Crickets chirping as to how old I am. Of where that, or we would view through a two-way window. That was how my work was done. I'm really cracking up now about how old I am and how long I've been licensed, but that's okay. So that was the process and the procedure at the time for me to get my clinical license. Now, other master's level clinicians, where their coursework sometimes our coursework overlaps, it may be a little bit similar and a little bit different. What we do is a little bit different as well. Other master's level clinicians, there are licensed clinical social workers and licensed marriage and family therapists. There's also, depending on the state that you live in, my license in particular in the states of Georgia and Texas, I am known as a licensed professional counselor, but in different states, including like California and in Florida, I might be referred to as a licensed clinical professional counselor or a licensed mental health counselor. Again, the criteria for each state varies. So the licensing requirements for each state varies not only for the degree or the discipline. By discipline, I mean whether you're a counselor versus a social worker versus a marriage and family therapist, or also through the amount of hours of supervision that is required for you to be able to work independently, and also for testing requirements. I have very dear friends from Georgia who, for their social work exam, they had to take 2. I only had to take 1, and I was okay with that. But what I'm going to do as part of this video is put a link in the description box below to the blog post where I talk more in depth about all of the different credentials that helping professionals can have, and also the different places where you can look for how to verify the different credentials that your licensing professionals have. For me, as a licensed professional counselor, I've focused more on working with the individual as opposed to with families or with couples. That was the coursework that I chose, and that was where I did my supervision. That was the area that I was interested in. A lot of my personal background, too, was a little bit different because it's in applied psychology, not necessarily in counseling. That means a lot of my heavy coursework at the time was related to psychological testing and psychological assessment. That means IQ testing, achievement testing, memory testing, a lot of the type of assessments that you give if you are going to diagnose a learning disorder, or if you're going to diagnose giftedness, or if you are even going to diagnose dementia or Alzheimer's. Now, as a master's level clinician, when I did that kind of work, I worked underneath the supervision of a psychologist. I could not do any of that testing independently. Yet it was a wonderful, wonderful skill that helped lay the framework for me working with my kids, as I called them when I worked in GV Justice in the early part of my career, who either had learning disorders or special needs or learning disabilities, and also paved the way for me to work with my kids in public education. I like to think I was a pretty valuable member of the IEP team and the resource team for the SPED department. They always called me to go for the meetings, probably because I was a really strong advocate. I kind of got myself in trouble sometimes because I was always more on the side of the parent. I'm going to stop there for a minute. But hey, once an advocate, always an advocate. So in addition to that, when I was ready to pursue my counseling license, I had to take a few additional post-master's degree courses to make sure that I covered all the bases that the licensing board felt I needed to cover at the time. So then that's how I obtained my counseling license. Other professional clinicians at the master's level are social workers. Social workers do things that are a little bit different, and here's a brief description of the work that social workers do. Licensed and marriage and family therapists also do something just a little bit different, and here is a brief description of some of the work that LMFTs do. Yet all of our professions serve a purpose, that is to serve the client's needs. So how do you determine which professional it is that you need? Well, it depends on what type of services you are looking for. Here is a description of some of the services that an LPC can provide for you, an LMFT can provide for you, and an LCSW can provide for you. Okay, so beginning with licensed professional counselors. This is my background, and this is what I have done for the bulk of my career. We work with individuals across the lifespan, all ages and ranges. We can work with groups, we can work with individuals, children and families, people who are elderly, with unsheltered individuals, immigrants or veterans, or people who have addictions, mental illnesses, criminal records, employment issues, or disabilities. We work with a client-centered outlook to diagnose and treat mental health and emotional disorders, including addictive disorders. We provide direct therapy to clients in individuals and group settings, and we also participate in research. So we can work across the lifespan and across age ranges with different treatment modalities and therapies. Now on to licensed marriage and family therapists. They have a little bit of a different focus. And here is what the AAMFT says about that. Their traditional emphasis, they broaden their emphasis from the individual to focus on the impact the client's relationship networks, and they extend it broader out into the family. They can also diagnose, in terms of mental disorders or for psychological treatment for individuals, families, or groups. They cannot obviously administer psychological tests, prescribe medication, anything along those lines. They treat all different types of diagnoses and disorders from depression, anxiety, marital problems, substance abuse, but more of their focus is the systems and the network of an individual's greater network of individuals that are impacting that person's life, as opposed to focusing just on the individual. They focus on relationships and how those relationships in turn impact their clients and how their clients impact those relationships, and what we call a family systems approach. So now let's get ready to move on to licensed clinical social workers. Okay, licensed clinical social work, they do a lot of their scope of practice is very similar and very broad in comparison to LMFTs and LPCs. This is our examination and state licensing requirements, but they also have a very broad scope of practice. They can work with individuals, they can work with families, they can work with groups. And they can also assess, diagnose, treat, and offer interventions. They can clinically do crisis intervention and clinical assessment and diagnose and give diagnoses. And they can take what we call psychosocial assessments or evaluations. They can give certain diagnostic tools. It's not the same as psychological testing, but they can also do observations to kind of observe what's going on in the family or what's going on in behavior. But they also provide counseling and psychotherapy services as well. And they can use some of the same therapeutic techniques that the other two approaches do, like CBT, cognitive behavioral therapy, or DBT, dialectical behavioral therapy. So they do a plethora of things as well. Other mental health providers that might be included as part of what I would consider our giant community treatment team. These are related professions. Usually, these are the ones that I'm going to talk about that are in terms of medicine or health, also in mental health. We have psychiatric mental health nurse, nurse practitioner, physician's assistant. Here are some descriptions of the jobs that these professionals do.
So for this video, we are going to go visit the Homeschool Counseling Network website. You can find all of this information under Resources for Parents and under Counseling 101. This is where you'll find all different types of information about the different levels of mental health providers that we've talked about, from the master's level to we're going to get to the doctoral level in just a minute in this little section. In this section, I particularly refer to 3 physicians, assistants, psychiatrists, and psychiatric mental health care nurses. And there's all of their different levels of alphabet soup that you find there. So for more of this information, be sure to visit homeschoolcounselingnetwork.com under Parenting Resources and Counseling 101, and you'll find all sorts of descriptions for all different types of therapists and levels of care right there on our website, homeschoolcounselingnetwork.com.
What about psychiatrists versus psychologists? Here's a description of the difference between these 2 different professionals.
Okay, so here we are back at the Homeschool Counseling Network website, and you can see that psychiatrists are actually MDs. They went to medical school, they are medical doctors, and they can prescribe medication. It says here that some do offer talk therapy. I've met a few who offer a little bit of talk therapy, but it's not as common any longer. Now, psychologists are doctoral level clinicians in psychology. They can either have a PsyD, a doctorate in psychology, or a PhD, counseling or clinical. They are trained to identify and treat a variety of mental health disorders through talk therapy. I didn't say anything about it here, but in certain states, some psychologists do have prescription privileges, and they do have to go through additional training and supervision for that.
What about other support professionals? While the list that I've already shared with you seems kind of long, there are other professionals that help support the homeschooling community in terms of either mental health or in terms of counseling or in terms of service. So in upcoming videos, down here somewhere, wherever I'll put the card or the description, we're going to talk about the other support professionals that are a part of the Homeschool Counseling Network and that help to serve the homeschooling community. In upcoming posts, be sure to look for those. Some of these areas include registered play therapists, occupational therapists, physical therapists, speech therapists, and so much more. So be sure to like and subscribe so that you will know, and ring the bell so that you will know when new videos arrive, and you can learn about all of the other different professionals that are a part of the Homeschool Counseling Network and how they can help you and your family on your homeschooling journey. For now, thank you so much for watching, and thank you for being a part of our village. Take care. Bye-bye.